Good evening, welcome to Head to Toe with Dr. T. Sichale Mpembe namhlanje, but in a different way. Welcome and please enjoy. Sithetha ngempilo yakho okanye isizalwane sakho, simamele so that uzonceda umuntu ngenye imini. Mr. Lutata, thank you for accepting our invite to join Head to Toe with Dr. T. Can you greet our viewers before we get to know you better?
Thank you, Doc, for having me on the show, and good evening to the viewers at home.
Yeah, ungumni mfondini.
Ndingufako, uTashaka ndaye noziqale kazi. Hlamba ngobende.
Yeah.
Tim Law.
Yes. Uludada ngubani? Your full name and everything, and where did you school? What are you doing? Educate me. Uludada and Associates Orthopedic Services.
Uludada lo nguNcedo ngegama.
Ewe.
Kwangapha eMthatha uzalelwe ngapha eLibode kulala ekuthiwa kuseNtlaza. Ngokufunda ke ndipase i-high school yam eChief Henry Bokleni. That was 2002.
Sisikolo senkosi.
Sisikolo senkosi eso. Ndafundela esikolweni senkosi.
Igazi lobukhosi.
Ndinalo ndingufako ndishilo ndingufako so igazi lobukhosi lilapha kum. So ndapasa ke eChief Henry Bokleni ngo-2002. Ndafumana ke inyweba yoba ndifumane ibhasari kagovernment yofunda eTanzania ufunda i-orthotics and prosthetics. So ndafunda ke Tanzania.
From the South African government?
Yeah, from the South African government, sure. Yes. That was due to the shortage of the professionals in orthotics and prosthetics. So I
can imagine, especially in the black communities. I mean, even to mention Lamagama is quite an effort.
Exactly. So the idea was, it was a recruiting and retainment strategy by the government to get us to go and study and then come back and serve those communities. So overall, we were 15 in total through that program. But that program elapsed. But upon finishing, I came back and also sebenza a provincial hospital.
So how many years did you take in Tanzania?
It's a 4-year program. It's a 4-year BSc program.
Okay.
So I came back.
So it's BSc in?
Orthotics and prosthetics.
Okay, sure.
Orthotics and prosthetics, yes.
4 years.
4 years.
In Tanzania?
Yes. Then I came back as a bursary holder. I was already guaranteed employment. So we were retained by the Department of Health. Ndasebenza East London Free Hospital. I worked there for 3 to 4 years. Ndakhangela amanye amadlelo ndafuna uziphuhlisa.
Okay.
Ndafumana ndanenhlahla kwakhona ndafumana scholarship sofunda eAustralia ukwenza i-clinical rehabilitation. Clinical rehabilitation now was to look into the rehabilitation at large, not only from my point of being an orthotics and prosthetics. I wanted to tap into what do the OTs do, what do the orthopedic surgeons do, what does speech do, and how does it all come together, and how can you develop a rehab program. So that was just to give me more insight in the rehabilitation space. So when I came back, I worked at Walter Sisulu University as a lecturer.
Okay.
For 1 to 2 years. Then 2018, I started my own practice. I've been there since then.
So you started your own practice in Mthatha?
Yes.
And then now you are in Gqeberha. What's up?
Okay. What's up with Gqeberha? It's a new branch that I've opened in Gqeberha. There's an opportunity for me to come and expand and increase my services to this side of the area. So that's how I came about to be in Gqeberha.
And then where about are you?
At 134 Kempston Road. It's called B&E Conference. It's just opposite Mercantile Hospital. As you drive up Mercantile Hospital, we're on the left side. It's called B&E Conference Center. That's where we operate in Gqeberha.
Wonderful. In simple terms, what does an orthotist and a prosthetist do? What do we do? Don't know in simple terms. Senze lo mntana obukeleyo wasezilana ngikhombe ndiyabona uba ngulapho why Tanzania, why Australia, why ifumene ibhasari, and then yintoni oyenzayo day to day?
Day to day, an orthotist, it's 2 fields. There's an orthotist. An orthotist basically, it assists where you have, let's say you have a fracture. Yeah. And the fracture needs to be mobilized so that is our pole.
Okay.
So we manufacture that device that is supposed to stabilize you. You'd say, umuntu would think abantu bophukileka ifakwe la cement. Yeah, but we are not actually putting on a cement. We actually manufacture a brace now that's going to hold you. Even if mhlawumbe une-problem ne-neck,
ezingathi ziboots
zonke
into
zonke ezaa nto zimmobilizayo, that's what we do. We also do is that enhancing functionality from someone who is permanently or physically disabled. For example, abantu abane-polio, abantu abane-stroke, ufike benezandla ezithe. So we support their splints so that the hand can be in the functional position. That is the orthotic side of it.
Okay.
Then the prosthetic side now means it's when you have a missing body part. That is unqunywela umlenze, unqunywela ingalo. So we actually manufacture now the prosthetic leg or a prosthetic arm for you. So that is the prosthetic side. So that's what we do day in, day out.
Wonderful. Let's sit on the feet today. Sohlala ezinyaweni mos.
Ewe,
Usiphathele ntoni ezinyaweni?
Sesezinyaweni namhlanje. Ezinyaweni
Intoni engxaki zenyawo ezibangela into abantu baphele bekuni. So that people can learn, and we're looking into preventative medicine before, and then xa sezenzekile izinto, you are fortunately in the rehab space so that abantu bangacingi uba kuphelile ugqityiwe and so on.
Imilenze esiyenzayo into ebuhlungu isikakhulu yenziwa ngabantu abane-diabetes. And i-problem, i-point of entry ipha enyaweni. Being diabetic doesn't necessarily mean you have to lose a limb, but it just means now you need to take care of your feet. Your feet
Kukho abantu abathi utata omkhulu wanqunyula umlenze notata wanqunyula umlenze, so it means nam zanqunyula umlenze, and then iyafuzwa into onqunyula umlenze.
Ndingathi into engabe iyafuzwa onganenlightena kuyo into yobana i-diabetes, is it something which is hereditary? And if it is, but amputation is not.
Thank you so much. And thank you. That's a very important distinction. I-diabetes, unqunyula umlenze akufuzwa. Utsho uMr. Lutata akufuzwa unqunyula umlenze, ndiyamnqenela. But i-diabetes sineentlobo ezibini ze-diabetes. Sino-diabetes ekuthiwa ngu-type 1, sibe ne-diabetes ekuthiwa ngu-type 2. U-type 1 yile ntlobo yeswekile where ixhaphake ebantwaneni, ufumanisa umntana akanawo total insulin. Funeka athi nje isamqala iswekile abe sebenzisa inaliti yohlaba insulin. But le ntlobo yesibini yeswekile kuthiwa ngu-type 2 diabetes, which is common ebantwini abatyebileyo and ivela somdala, sithi ngu-adult onset ngamanye amagama, yona inayo i-element yofuzwa. Fumanisa uba if umama notata ba-diabetic ngabantwana abayi-4, ababini benu bazawuba nayo iswekile ngokuqinisekileyo. Yiyo le nto funeka nikhule niyazi into yoba apha ekhaya singabantu beswekile. But importantly, unqunyulwa umlenze yi-complication yeswekile, ayonto ifuzwayo. So awunothi hayi ndihleli ndizanqunyula umlenze uba utata wanqunyula umlenze. No, it doesn't work that way. But unoba nayo iswekile because ikhona ninomnombo weswekile apha efemelini. We're gonna take a break and then we're take you further on le nto onqunyulwa kwemilenze, into yoba yintoni ke ngoku eniyenze nina to make sure into yoba abantu still have a quality of life. We're here to prevent complications, but xa sezikhona, what do we do kubantu abathe balimala emilenzeni? We're gonna be back shortly. Don't move away from your screen. Welcome back to Head to Toe with Dr. T. Sino Mr. Lutata, our orthotist and prosthetic. Ngumntu lowo ofakelela imilenze nobangela uba xa uphukile usiya kumileni umlenze wakho okanye isandla sakho sikwazi into yoba sigcinwe sikwishape ethile. Le nto singabikho mobile kakhulu, usebenzisa izixhobo ezithile nezinto ezithile azimanufactura ngokwakhe, usicacisela ngaloo nto. But silapha emilenzeni kakhulu ecomplicated yiswekile, then umntu aphele esenziwa i-amputation, which is very common. Thank you for that distinction. And then can you take us further?
Okay, into eyenzekayo nethuba ne-diabetes, what diabetes does, it actually kills the nerves. It actually affects the nerves. And it also affects the blood flow to the feet. Now, what that does, it means you're losing sensation on the feet, which means you can either step on any sharp object, you might not feel that, or you might be bearing weight in a manner that is not normal. You might be having an imbalanced weight distribution on the feet, and what you end up having what we call a callus, where you have an irritation of the skin. And over time, what that does, it develops to be an ulcer. And once it starts having an opening to the inside, then you get an infection. And now remember, you don't have sensation and you don't have good blood flow to the feet. That becomes a neuropathic ulcer. And then from there, chances are it leads to the amputation. Now, that is basically how it comes about. Now, what we try to do to prevent that is, once you are diabetic, we really advise one to monitor their feet take care of their feet. The type of shoes that you wear, you need to wear shoes that are flexible, that are going to allow your feet to be comfortable and breathe. You don't want tight shoes. You don't want shoes that are going to squeeze your legs. You want your legs to be as comfortable as possible. That is one part. And secondly, when you realize that something is not right with your feet, you really need to report ASAP, either to your GP or to your podiatry. People that are specializing in this space is podiatry.
Yeah.
So for us, we only do a component of manufacturing the device that they would recommend that we provide for that.
So a person is first to be seen by, let's say, from a GP or from a specialist physician. They go and see a podiatrist. In fact, routinely, diabetics are required to see a podiatrist just for fit checkup and whatever.
Yes.
Then from a podiatrist,
A podiatrist will tell me, can you help me with this patient? And when I put my patient on the force plate, I would actually see the weight distribution. And I would say, okay, this person is putting weight on this part of the feet, and this is the risky area that it will eventually develop an ulcer. So we try and rebalance that so that they don't put pressure on one side of the foot. Remember, abanye sine kiss, abanye sine zgwepe, abanye sine new conditions that makes us not to put weight appropriately. So we try and adjust that to prevent, because once you start putting your weight comfortably throughout the feet, you won't have any acceleration because you're spreading your weight. Pressure too much. It just becomes evenly distributed. So we do that by manufacturing what we call.
And so on. There's a lot of stuff.
That tells them there's something wrong. There's something wrong in there. Sometimes it could be a wrong shoe for a wrong feet. We need to understand also our feet, or make up our feet. So and the long because the was not solo point, the slang was sharp up and long goes. So if you squeeze they're not really comfortable, and if you're diabetic, that can lead to something else. So those basically what we actually do. We then design an insole that we insert in your shoe so that you have a weight that is evenly distributed. Especially people that are having jobs that are standing for a very long time, realize that if you're standing 8 hours at work, you're putting pressure in that one spot over a very long time.
Okay.
And that's what really causes irritation and can open to an ulceration of the foot if you are diabetic. So that's basically the background.
Thank you so much. So very, very important highlight is that diabetic can lead to complication of peripheral neuropathy. Ufumanisa uba lo muntu igazi alihambi kakuhle, ii-nerves azicholacholi kakuhle imvakalelo phaa ezinyaweni. Then ufika umuntu noba wothe ihita okanye wothe imbawula ezifaka because akeva kakuhle, then that can lead to gangrene, then kuphele kubola unyawo, kubola umlenze, kubola elantuka, then uphele unqunyulwa. There's one thing abantu abathanda uyenza, babe reluctant abantu xa kuthiwa hey lo bhonzi ufile lo ufile kufuneka esusiwe, okanye ihafu yolunyawo kufuneka ususiwe, okanye ihafu yalomlenze kufuneka isusiwe. But once uyiyeke laa nto igangrene iyayinyuka uyawuthi uvuma kube sekonakele indawo eninzi, and then kulapho ungena khona wena. Africans baye bakhalazela into yoba ndifuna ungcwatywa ndingaphelelanga and so on, ndifuna ungcwatywa nomzimba wam wonke xa befuna be-amputatiwe. And then when you are seeing a lot of amputees, is there hope and life after amputation?
Before we go to life after amputation, my people are very, very stubborn, if I may put it that way. Remember, diabetes kills the innervation to your leg. And then you see them on time, and you can see that something is not coming right here. You can see there's a signs of acceleration. You tell them, no, you need this. And they'll tell you, you know what, nah, this foot, I'm not feeling any pain. I'm fine. I don't feel any pain. And rightfully so, you're not going to feel any pain because your innervation is affected.
Yeah.
So they are stubborn to say, it's like, don't treat me when I don't need treatment.
You know how I get around that? What is happening on the feet? Diabetes, when it does that, you will definitely have erectile problems. One thing I tell men, indoba umzwakho uzawuphela. Impempe igazi alihambi kakuhle, ii-nerves azicholacholi imvakalelo kakuhle. Izawuba ngayibamba umama ekhaya ixikika le mpempe zabo manyuke, ayinyuki because ii-nerves azivakalelwa kakuhle. Xa uthetha nganyawo mhlawumbi ayizuvakala kamnandi, but xa uza ngasempempeni uyayazi into yoba ayichaphazeli yena only, because i-diabetes, it gives us ample of time to do the right thing. We are able to check HbA1c. Siyayibona ii-nerves zingasebenzi by doing monofilament testing and so on. Sibase kwi-podiatrist, but still abantu batsibe apho until bafikelele kule ndawo siyaziyo bazafikelela kuyo. So maybe we should go an extra mile. Nibaxelele into yoba ndithi impempe njengoba inyawo zindindisholo nje zinenkantsi, nempempe inenkantsi, and izawuthatha ithuba uphakama and umama ekhaya uzawulamba, then kuphele umtshato usiwa okanye umzi usiwa ngenxa yantoni? Neuropathy nale nto uyithethayo, blood flow.
Okay. Now xa sekukubi ke ngoku sekwenzekile, there's an ulceration, there's still ways out. With the help of a podiatrist and doctors, of course, there's a way of trying to address the ulceration.
Yeah.
There are specific shoes that we provide that kind of offload weight from the ulcer area. You kind of have a shoe that doesn't allow you to put weight where there's an ulcer because we want to promote healing.
Okay.
So there's a shoe that we provide for that. No, unfortunately,
okay.
It's basically a heel. It's basically a shoe with a heel, a high heel, but at the forefront is just open, so that your leg can be. Basically, most of the time, the ulcer is always on the forefoot part.
Definitely, we're gonna hold it there. Isilonda siyathanda lapha ngaphambili enyaweni, uthe sihlangu sakhe uludada basenza ngokwabo kamnandi sebesithathishe unyawo lakho, sigxinisa apha esithendeni, then silwenza unyawo luhlale luvulelekile umove apha ngaphambili. We're gonna take a short break and then we're gonna come back and look more into prosthesis and also orthotics, uba yintoni le nto, singancedakala njani, so there is no lost hope after everything has happened. Xa uluze unyawo ikhona into eyenzekayo, naxa une-ulcer zikhona izinto zokwenza uphole fast. Welcome back and thank you for sticking with us. Sijonge namhlanje xa uthe waqhawulwa inyawo okanye waneengxaki zeswekile apha ezinyaweni, of which zininzi ke ezibangelwa kungasebenzi kwee-nerves okanye zicholachola imvakalelo kakuhle, ungahambhi igazi kakuhle. Sithetha nomsiyelo udada oyi-orthotist and prosthetic yethu apha eGqeberha naseMthatha. Bethethile ngesihlangu abasenzayo sobangela benyawo noko livuleke pha ngaphambili, igazi libaye kakuhle to facilitate i-wound healing. Zeziphi ezinye into ezizenzayo kubantu abaneengxaki zeswekile apha ezinyaweni?
Now, ezo ziyi-2 busy orthotics ezo. Then the last part now is when the leg has been amputated, when the infection has gone through up to the bone, and the doctors decide that there's nothing that can be done. It needs to be amputated, or there's gangrene, then it needs to be amputated. Then now we shift now to the prosthetic products now, where we manufacture a leg for you. It can either be on the foot part, it could be on the ankle, it could be below the knee. Sometimes it even goes higher, even above the knee. That's when now we start manufacturing a prosthetic device, a prosthetic leg for you. That is basically what I'm seeing
So
most of the time.
milenze kazenzele.
Milenze kazenzele, exactly.
What do you go through? Because ndicinga nale ka-Oscar ngobaleka ngayo, it means you guys are too advanced.
Exactly. It depends. It depends. But of course, the process is the same. But it also depends on the functionality of an individual. We need to assess you how you were before amputation, your activity level, and we see what are the chances of us taking you there. But also, we're not working alone. We also need physiotherapists. We also need occupational therapists, because physiotherapists, they are good with training the physical part of it. Remember, now we have lost certain part of your body, so there's adjustments that needs to be done. So physios, they challenge you so that you can be back up to your functional capacity as much as possible, even before we make the leg. So once then you are up to speed, then we can start the manufacturing process. The aim is not to give you a leg, it's trying to enhance your function. We don't do a leg for the sake of doing it.
Okay.
You are amputated. If you are working, we still want you to go back. Yes, we still want you to go back. We don't want you to go and sit back and say, I don't have a leg. There's life with prosthetic
it means there's a lot of coordination between you and occupational therapists in terms of what the person is doing.
Yes.
And then when they are going to come back for integration, what are they likely to be able to do still?
Exactly. I can make the best arm for a person who doesn't have arm, but the essence of that arm is for functionality, is to be able to do your activities of daily living. And people who are trained to do that are occupational therapists. So I need my physio before I see the patient to get the patient in good strength and conditioning. I make the device. After that, I've made the device. I need my OT to take my patient through to the activities of daily living so that the person can be able to dress themselves, wash themselves, dress up, do any activities right and do anything. That's where it all comes together now to enhance the quality of life and functional independence.
Wonderful. You're bringing life where there was misery. Now that we're talking about prosthesis, there's a conference I went to in Durban. It was a sexology congress. That's the first time I saw a penile prosthesis. Have you ever seen a penis? Now that you are doing legs and arms and whatever, have you ever seen a penis that is made of? That's your field, Mos.
It is my field, but we are not specializing in that space. I've seen them, and I can
I was
imagine.
really shocked, and there's a pump that you use to create an erection and whatever, and then the guy can continue.
Yeah, they are there.
So
they
you guys
there.
are doing a wonderful job. So you must, for us, I mean, in fact, for me, you must also look into this thing of penile prosthesis because a lot of penises are actually struggling. Diabetes is not only leading to dead feet, it also kills penises, especially in people who don't listen and control their sugar. The complications that we've mentioned, blood flow, this neural problems, they affect the penis a lot. And I'm looking forward, and I've got all the hope that you won't only end with legs and arms. You will also look into this disaster that is coming. There is hope in every misery that we go through. And then after integration, are people coping with this prosthesis? I see breasts can be made. Don't you do breasts also?
Yes, we do breast processes as well.
Okay.
We do supply those.
So how come you skipped this part?
And the one for
Must
breast?
have been.
No, I think because we're focusing on the feet, so I just kept it on the feet. I didn't consider the breast, but even the breast is also part of what.
Then, for the sake of people who are watching us, can you just mention all the processes that you are able to manufacture? And
I would say it's the limbs, where it's the legs, it's the arms, it's the breast. Breast often removed due to cancer.
yeah,
So that's cancer. That's all that is prosthetic. The rest, it becomes orthotics. Any part of the body, whether it being leg, lower limbs, or upper limbs. And then we also make devices that are supporting the back, where you have deformities. You can have scoliosis. You can have TB of the spine. Once the TB has actually got into the bone, it actually affects the structure of the bone and it makes it weak. So we also make supportive braces to make sure that you don't have any issues with your spine. And
so
also
nifakele intsimbi for umqolo ukwazi uphinda ume kakuhle ube ne-frame.
not necessarily internally, but there's a corset, there's something that we manufacture that comes around
Okay.
your trunk to support your back, because
Okay.
sometimes what TP does, it can actually chow part of your spine.
Yes.
So you end up not having a stable spine. So we kind of immobilize and hold the spine in that position. That becomes a trunk orthosis now. So those are basically the divisions that we work in.
That's a lot of work. So it means even on the breast, you take lots of measurements. How long does it take to come up with a new breast or with a new leg or with a new arm? What's the turnaround time?
The turnaround for a leg, it's a week. Turnaround time for a leg, it's a week. For a breast, it's 3 days.
That sounds fast.
Yeah, the only thing that delays these things is just administrative processes. Let's say you're coming with a medical aid. Now I need to write to a medical aid for them to authorize that. It just becomes an administrative process. But if everything was to be approved in a week, we could manufacture that and finish.
Then that brings me to another question. I've got quite a number of people who complain that they've been waiting for their prosthetic legs in the public hospital and whatever. Are you doing any kind of assistance? Is there any collaboration between you as in private together with the public sector to minimize the delays and so on?
In fact, that's what we are looking on. Last month it was a month of disability rights. So we're looking at how can we increase our service to those that are needed, because we know government is having a backlog. I know that backlog. We've been dealing with a backlog for I think in Namtata there are around 450 amputees that are on the waiting list, and government is working within the limited resources. So we are trying to establish a working relationship with government to kind of increase the service to that, because they really wait for. There's a guy who had waited when I was at WUS, who had waited for 43 years for a leg.
That's excellent. We're trying to minimize the waiting time. Unfortunately, utshaba lexesha sifikele esiphelweni senkqubo yethu. Enkosi ngoba nathi silandeleni kwaPhile Communications, sibukele iTV qho ngomvulo 7:30, head to toe with Dr. T. Siyabulela nto kalutata. Inga urhulumente angakumamela sizama unciphisa i-backlog yabantu abalinde imilenze, yabantu abalinde iingalo zabo. Ndinethemba le nto uba nomcimbi wempempe uzawuadreseka ii-prostheses sizifumane kufutshane. Thank you so much.
Siyabulela.